Dr. Christine Long, host of Heard This. Today we're here at Pineview Veterinary Hospital in Bolton, North Carolina to talk about equine dentistry and why it's important for your horses to have their teeth floated on a consistent basis by your veterinarian. We are here with Snickers, who is here today for his equine dentistry. You know, we talk about all the time horses needing their teeth done and what that means. The technical medical term for taking care of a horse's teeth is floating. It's an ancient term that comes back from when the first equine dentists used to float the dentistry tools along the surface of the molars of the horse's teeth. That floating action of the grinding tool used then is where the term float came from. So you've oftentimes heard a horse is going to get their teeth floated. That's where it comes from. So Snickers is here today, and because he's been dropping feed, that's 9 times out of 10 the most common complaint that owners have about their horse and why they may need their teeth floated. Other concerns that owners may have as to why they may want their horse's teeth evaluated and or treated with the floating procedure would be from weight loss, fighting with the bit if they're being ridden and the horse is throwing their head quite a bit. Some horses pack food in their cheeks. They can literally look like little chipmunks. That actually is a method in the wild. Owners ask me all the time, how do horses in the wild survive when they don't have a dentist or a veterinarian doing their teeth? They pack food in their cheeks to protect their cheeks against the sharp points that are created from those molars. So weight loss, trouble riding, fighting with the bit, dropping feed, things like that are the most common reasons why we would do horses' teeth. So what we're going to do today for Snickers is make sure he's in good health and also sedate him for a standing procedure and then float his teeth.
The rural American lifestyle. It's how we work and it's how we play. It's how we learn and how we enjoy the finer things in life. How we take care of our animals and tend to the land. It's a way of life. Has been for hundreds of years. Now there's a whole new way for rural America to watch TV.
So we've got Snickers here in the stocks. This is obviously a nice comfortable environment for him to have his teeth floated today. I would say that probably 90% of the dentistries that I do are not here at the hospital. That is owner preference. Our practice here, we do, I'd say 90% farm call work. We have 3 trucks that run the roads, and we do a lot of equine dentistries. So 9 times out of 10, we don't have the luxury to put a horse in some padded stocks like this. However, today, for nice, comfortable purposes and for Snickers, we're going to explain equine dentistry and how it works here. So we've got him in the stocks here. What we're going to do is listen to his heart, make sure he doesn't have any arrhythmias or murmurs. That's extremely important because I am going to use some drugs to sedate him, make him comfortable. I oftentimes have to remind owners, because I'm cognizant of it myself, he remembers everything. Horses remember everything. He's going to remember this procedure, and I want it to be a comfortable procedure for him. I don't want it to be painful or scary in any way. I am a firm believer that sedation is necessary to not only keep the horse comfortable so that he has a good experience, but so that I can examine his mouth completely and evaluate him in a nice, comfortable manner. So I am going to use sedation, listen to his heart, and make sure that it sounds good. Good. Good boy. You're a good boy. Yeah. Okay. After the horse has been given his sedative, the particular drug that I like to use most often can take about 7 minutes to take effect. I do give horses 7 minutes to enjoy their travel into La La Land. And I feel like waiting the full 7 minutes gives me time to talk with owners about why we're doing what we're doing. So when we talk about horse oral anatomy, some owners know this and some owners don't. I get asked oftentimes, why do horses develop sharp points in only specific areas? Don't you grind down the entire molar? Things like that. The answer is no, I don't grind down the entire molar. The instrument that I use that I'll show you in just a minute, actually I put it in very specific locations in the horse's mouth and grind those areas down because they're the areas of concern. When God made horses, He made them with their upper jaw set a little bit wider than their lower jaw. And so as a visual, if you can imagine, this is the upper jaw, this is the lower jaw. The outside edge of the upper molars, they never touch anything. Likewise, the inside edge of the lower molars never touch anything. So you have the cheek side and the tongue side. And naturally, as horses chew, they actually chew in an up and side to side pattern. Some horses are left side chewers, some are right side chewers, but nevertheless, they chew in an up over to the side type of manner. Those areas, the outer edge of the upper molars and the inner edge of the lower molars, they never touch anything. And therefore, as horses grind their teeth down and grow their teeth naturally over time, those areas don't get filed in a normal way. So they pinch their cheeks, they pinch their tongue, and they can get calluses and abrasions that make it uncomfortable for them to chew. I equate it to if you've ever bitten your cheek and then you bit it again, then you bit it again, and it's like, geez almighty, if I bite it one more time. That is what horses do. If they have those sharp points in those areas, they are constantly biting their cheek. So in addition to having an offset upper jaw that's wider and a lower jaw that's more narrow, God also designed them so that their upper jaw is set a little bit more forward and their lower jaw is set a little bit more back. Anatomically, this isn't necessarily something that most owners appreciate unless you have a horse that is called parrot mouth, where their incisors, instead of meeting on top with each other, they may be set forward some. That's an extreme example, but naturally all horses do have a forward placement of their upper jaw. This only becomes a problem when the back lower molars, that backside edge never touches anything. And so we can have that molar kind of coming up instead of a flat manner. It can grow at a ramp. So scoot back up the backside of the cheek here and actually create a point that just constantly jabs a horse in the back of the jaw. I see that complication in a lot of horses' mouths, and the clinical sign that owners come to me and they say, or I'm having trouble riding him. He's throwing his head around a lot when he's riding. When you pull on a rein or you put pressure in the mouth, it pulls the jaw back. And if there is a sharp point, and it can be as small as millimeters in height, it can affect a horse and cause pain. So it's really important that when you have your horse's teeth evaluated, that you have a sedated oral exam done, so that the veterinarian can actually look deep back in the back of the mouth and actually see if you have a problem there. Otherwise, just looking at the front of the mouth, you can't always know. So as you can see, Snickers is becoming sedate. It is not uncommon for horses to sway from side to side when they're experiencing the first parts of sedation. They may lean forward. Some horses actually respond negatively to sedation, and this is where having a veterinarian perform this type of procedure is so important, because we do have other drugs that we can give, given the circumstances, to make him more comfortable. He's tolerating his drugs very well. This is a classic sedated state. I think we've only been, he's been sedated for just a couple of minutes here, and you can see how quickly his head went from a normal placement to quite a low placement. Oftentimes owners will ask me, is he going to lay down? and no, he's not going to lay down. He should still feel the comfort of all four of his feet. There are specific breeds of horses that I do find are more lightweights when it comes to how much sedation is used. So I've become familiar with those breeds over time, as other veterinarians have too, and we use specific combinations of drugs to make them comfortable and to achieve the service that we're hopefully going to do, today for Snickers. So we're going to let him finish getting sedated, and then we'll get started here in a minute. Hey there, I'm Christine Long, owner of Pineview Veterinary Hospital here in Bolton, North Carolina. We are an exclusive large animal veterinary practice. We provide 24/7 emergency care and routine services for horses, cows, sheep, goats, llamas, alpacas, and pigs. We are currently a staff of 2 full-time veterinarians, myself and Dr. Leslie Jarrett, and we have a wonderful secretary, Donna Jacobs. We provide veterinary services to the northeastern part of South Carolina and the southeastern part of North Carolina. So if the need arises, give us an opportunity to serve you. Okay, so we are ready to put the dental speculum on Snickers. He is nice and sedate. We've waited our allotted time. He has found himself a comfortable stance in the stocks. Having him in the stocks is very nice, because if he wants to lean up against the side, he can. He's actually got his left hip up against the side. Just know that, again, 9 times out of 10, I do this procedure in the field. So having him in this comfortable of an environment is not a necessary requirement for this procedure. However, for today, it's certainly nice to be able to explain everything to you. So what I'm going to do is actually put this contraption on his head. It does look a little, medievalish. But this is called an equine dental speculum. There's lots of different types. It doesn't necessarily have to look like this, but the concept is that it slips over the pole of the horse, and actually he bites down on the dental plates here, and then allows me to open that up so that I can hold his mouth open and examine the inside of his mouth. I joke with my vet students that come and ride, this is probably one of the most challenging parts of putting of the equine dentistry procedure for a student that's learning, is putting this contraption on a horse. You definitely do want to keep your head out of the way, just in case he decides to throw his head. He could at any point. Good boy. There you go. And so just easily slipping it in between his incisors so he can bite down on that dental plate, and then just like a halter, it goes right behind the pole. So you can see here, I kind of keep my head out of range for him to, if he wants to move it up, he can. That would be unfortunate if he were to hit me in the head. And then I just easily do the first couple of clicks, make sure I don't have his cheeks and his lips caught in the dental plates. Pinch him, that would not be nice. And again, making sure that his tongue is free from the lower dental plate here, so that I don't pinch him when I'm opening this. Now, over the years, I've learned how wide the average horse mouth is. Snickers is a quarter horse here of a mature age, so this is about as comfortably wide as I'd like for him to be. But you can see he tolerates putting it on and with it in his mouth very well. So what I'm going to do is actually clean his mouth out here. You can use straight water if you want to, but I choose to use a little bit of a antiseptic wash. Children ask me all the time, does it taste like bubblegum flavored? No, it does not taste like bubblegum flavored. I should probably come up with a bubblegum flavored horse mouth rinse. I would, I'm sure, make a killing. So anyways, and what I'm doing, you can see what's dropping out is grass. He was out in the paddocks here at the office munching on a snack. So he's got some food packed up in his mouth, which is not uncommon. You want to get all that out so that you can really take a feel and see what's going on good. If you have a bunch of hay or grass packed in the mouth, you're not going to be able to evaluate his entire oral cavity very well. So we're going to rinse that out really good. But you can see he does not mind this at all. Every horse is different. I read horses by their ears when it comes to this procedure, because he is sedate. His ears still tell me what he's thinking about. Right now, he is not concerned with me one bit. He is focused on other things around, but you'll see as the procedure gets started, which the procedure itself is anywhere from 30 to 45 minutes. It doesn't take very long at all. It depends on the horse and what their problems are in their mouth. But their ear placement changes. You'll see as I'm doing the procedure, he will focus on varying things. That's extremely important because even though he's sedate, he could lift his head up if he wants to. If we're outside and in a garage or a stall environment or a field or off the back side of the truck, he could walk away if he wants to. If he's not paying attention to me, I need to know it. And when they're sedated, obviously their movement is sedate, and their head placement is a little slower than normal. But the ears, they remain the same. Okay. So we've got Snickers comfortable. He's standing very well. We've got him in the speculum, and we've now got him on a headstand. I have 2 pieces of equipment that I use to hold horses' heads up, or 3 if you want to count the shoulder of a technician or the owner. However, the headstand, and we do have a sling that we can throw over the stall, piece of wood or something like that to hoist the head up. We're going to use a headstand today if he'll be comfortable with it. But now I've cleaned his mouth out, which is extremely important so that I can evaluate the entire dental field very easily without any sort of obstruction getting in the way. Now, once I got him in this situation, I will do a visual examination by looking into his mouth, and I'm just gently spreading his cheeks and looking back there. I can see all the way to the back of his mouth. And then for me, I've found that a digital examination is the most informative. And so I'm simply taking my hand in an upward pattern, upward placement, going all the way to the back of his mouth very easily and comfortably for him, and just feeling. So you can see right here, I'm pushing on his cheek. That is how far his, what we call dental arcade, or his last molar, it goes all the way back here. So back to below his eyes. Likewise, the roots for those molars are actually extending all the way up this way and down this way. So the molar part, the grinding part of the horse's mouth, is actually very large. It extends from about here all the way to here. So it's quite a distance. And again, the outside edge of those upper molars are what I'm feeling. Over time, I've learned to gauge them in a mild, moderate, and severe type of sharpness. That helps me explain things to owners. So right now, I'm feeling his cheek side of his upper molars all the way to the back, and I would consider them moderately sharp. So it does not surprise me one bit that he's having trouble chewing, dropping feed, or anything like that. He actually also, if I feel his cheeks, he has some calluses in the back of his mouth where those sharp points have been rubbing and rubbing and rubbing. That's not uncommon. They'll heal just fine after I remove those sharp points. Now I'm feeling the lower arcade of molars, the lower line of molars. Again, mild, moderate, and severe is what I gauge those sharp points. So this is the tongue side, the inside edge of those molars. They are not as sharp as his upper ones, which is not uncommon either. I would consider them more mild to moderate. His tongue feels good. I don't feel any calluses or cuts, abrasions, of anything like that. The other thing that I'll check is, does he have all of his teeth? Yes, he has all of his teeth. It's not uncommon for horses to actually have a wave. And so when you look at their dental arcade, if you expect them to have a straight line of molars, they actually don't. They have what's called a wave. So their teeth kind of go up, come back down, and go back up again. And it's a mirror opposite of that on the bottom. That wave, or what we call in the veterinary world that wave mouth, all horses have. Some just have it more exaggerated than others. As horses get older, Snickers is a middle-aged horse, still in his prime, so his wave is very subtle. As he gets older, it'll become more exaggerated, more exaggerated. That's important because certain molars in that line of molars will wear out faster than others. And if you have dentistry or oral evaluations done on your horse regularly, then your veterinarian will stay on top of that wave and how it progresses and kind of modify it in certain areas so that your horse doesn't have problems. Again, that's just why, even if you don't have a dentistry done every year, if your horse is comfortable and they don't need to have it every 12 months, they can get by 18, 24, 36, that's fine. But having them evaluated on a regular basis is important so that your veterinarian can catch certain areas of the mouth that may be painful or may be wearing out inappropriately. So,
are you thinking about a career with horses?
I love this.
We love this.
I love this.
I love this.
I love this.
We know. You'll love it too.
So what I've got here is a power float. There are hand floats that some veterinarians are still using today. However, this is a less traumatic. It's actually considered an atraumatic form of equine dentistry. There's a diamond-plated drill bit here on the end. It does make a noise, and so because it is an electric power tool, I do kind of evaluate the horse with the sound of it, see how they're going to react. And you can see his ear placement right now is really not paying attention very much to me. So I want to keep an eye on that while I'm doing the procedure. But he does not seem to mind the noise. So I just gently take this into his mouth, let him get used to the way it feels. It's normal for them to move their mouth. Nice, easy, low tone with the speed to see how he's going to tolerate the procedure. Most horses actually settle right down once they get used to it. Let's see what he does. So you can see I've got little bits of tooth right here. It's not uncommon for them to want to move their head just a little bit during the procedure. 9 times out of 10, they settle right down. If not, then we give them a little bit more sedation, whatever is going to keep them comfortable. Some horses like to move their tongue a lot. Some horses actually try and walk. Some horses will throw their head. So you want to pick that cocktail of sedation that makes it most comfortable for them. Do horses slobber during this procedure? Sometimes they do, but 9 times out of 10, they actually develop a little bit of a dry mouth. And so I keep a bucket of the same solution I use to clean them. I use it to wet my hand, and I also use it to wet their mouth if I need to. Some of my older horses that are missing some teeth and they just have gums, they tend to be my slobberers. Good boy. You're being a good boy. You do want to have an experienced professional, preferably a veterinarian, do this procedure with this particular tool, because this is a drill bit and I can take off more tooth if I wanted to. Traditionally, I only take off 3 to 5 millimeters at a time. I don't want to create a cavity or an area where that molar is going to become compromised by taking too much tooth. If you're not careful, that could happen with the use of this tool. As opposed to the older tools, the hand floats that are used, you're less likely to do that. But you can see he actually tolerates the procedure very well. It amazes me every time the number of horses that actually let me do this to them without much fuss, because it does vibrate their head. I find that most horses are a little bit more sensitive on the lower molars. That's where I'm at now, so we're halfway through his procedure. And so I, again, just like in the beginning, take it a little bit slow in the beginning, let him get a feel for it. It does feel like I'm gagging them when I go all the way in the back of the mouth, and so I can appreciate how that may feel. And just kind of take it a little bit slow. But once they know what I'm doing, I get started. Very good. Good boy. And so after I've kind of floated all of his molars, I always want to be thorough, make sure I didn't miss anything, and feel all of his teeth. Yeah, good boy. And make sure I didn't miss any spots at all. If there's any, even the smallest little hook can result in a problem. So I want to make sure I got all of his areas. And he's as smooth as a baby's butt. Yeah, you feel like a brand new horse. Okay, so you're good. I got him now. Yep, thank you.
You will.
So one question that I get a lot is the difference between a wolf tooth and a canine. So real quickly, because he is a male and his mouth is nice and open, so this right here is the canine tooth. Now, versus the wolf tooth, which is going to be really hard to see, but the first molar lives right up here up top. Okay, so the canine tooth is right here. They have them on the top and the bottom. And then if you look up top, right up here, where the first molar starts, way back there, in front of that first molar is where the wolf tooth would live. And so it's actually deep in there where my finger is pointing, right there would be where the wolf tooth would live. He does not have any wolf teeth, okay? Okay, so the difference between a wolf tooth and a canine tooth, number one, is placement. And so if anything you get from this little snippet of education is knowing where the wolf tooth actually lives, okay? And again, that is in front of this first upper molar. It is not down here and right here at the bar of the mouth where the canine teeth actually live. Now, male horses almost always have canine teeth. That is, in the wild, they use those for fighting. There are some genetic anomalies where some mares will have canine teeth. So it's not uncommon to see a mare that may have 1, 2, or sometimes 4. That's just a genetic anomaly. So with that said, the wolf tooth, I want to explain to you, is like the canine in the sense that it is a single-rooted tooth. It's actually considered a premolar. However, different from the other molars, it's just got one root. Our molars, we have multiple roots. Same for horses. They have 3, if not 4 molars, or molar roots. The wolf tooth, however, does not. It has 1. And so because of that, it is a very unstable tooth. Because it lives in front of that first premolar, you can imagine the bit hits it a lot. So if I have owners that I'm doing an examination and I come across the presence of wolf teeth, which are only single-rooted teeth in front of the first upper molars, just on top, if I see them, my first question to the owner is, are you riding this horse? Is this horse going into training? Are you going to be putting a bit in this horse's mouth? If so, we need to remove those teeth. They really don't serve very much function as far as the grinding nature of their eating habits or anything like that. However, they will get in the way of the bit. It's a simple procedure, a little bit of local lidocaine around the root of that wolf tooth, and we extract it very easily that way. It heals up very quickly. The mouth actually is one of the fastest healing parts of the horse's anatomy in general, so they do very well. So with that said, Snickers does not have any wolf teeth. Some horses, they have them, but they never erupt, kind of like baby teeth. They just never pop out. I don't know if he ever had his or if he ever had them extracted. It appears as though, to me, he never actually had them. However, if he did today, we would remove those, but he doesn't. So we're not going to worry about that. But that's the difference between wolf teeth and canine teeth. So at this point, he is done with his procedure. He did very well for it. I'm going to take him off the headstand now, rinse his mouth out just because that is the right thing to do. His mouth is dry and tacky and chalky from having tooth bits and dust all over the place. I think if I were a horse, this would be my favorite part of the procedure, because how often do they actually have their whole mouth rinsed out? And again, I am always cognizant of where my head is placed so that I do not get hit. They say sometimes a sedated horse is more dangerous than a regular horse. Again, this is a metal contraption, so I want to be careful, and I'm always careful of where my owners are. Today I don't have an owner. However, if I had one here that was helping me, I don't want them hovering over this horse's head while I'm fixing to take this off. So making sure that everybody is out of the way, just very gently closing the speculum here all the way, making sure his tongue is not trapped in there, and we'll take this off of his head. Sometimes they shake when you pull that off, so be wary of that. But otherwise, it's nice having that off your face, isn't it, buddy? I think you can see from this side too, he's sweating. That is totally normal. It's actually a sympathetic nervous response for almost all horses after they're given particular sedatives that we use to sweat. So if you see your horse break out in a sweat along their shoulders, chest, flanks, face, that's totally normal. That is an equine dentistry on Mr. Snickers here, and he is going to enjoy his fresh mouth, free from any hooks and sharp points that would otherwise have been making it uncomfortable for him to eat. He's already a nice healthy body condition. He'll have no problem gaining a few extra pounds if his owner allows it. So that is an equine dentistry. Appreciate you riding with me today. Thank you for watching.